This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Doloneuron 100mg tablet is designed to manage nerve pain effectively. It combines gabapentin and methylcobalamin for optimal results. Indications and uses. This medication is effective in managing various types of nerve pain, particularly neuropathic pain, which can occur due to conditions like diabetes or nerve injury. It aids in reducing pain sensations by acting on the nervous system and is also beneficial in the repair of damaged nerve cells, thus preventing further nerve damage. How it works. Doloneuron works by reducing pain signals sent to the brain and rejuvenating damaged nerve cells, thereby providing pain relief and enhancing nerve protection. Directions for use. Patients should take Doloneuron 100mg tablet according to their doctor's instructions. It is recommended to swallow the tablet whole with a glass of water and not to crush or chew it. The medication can be taken with or without food, and the prescribed dosage will depend on individual health conditions and responses. It is crucial not to discontinue the medication abruptly without consulting a healthcare provider. Possible side effects. Users may experience side effects such as dizziness, sleepiness, nausea, and changes in mood. It is important to monitor these effects and consult a physician if they become bothersome. Precautions and warnings. Before using this medication, patients should disclose any existing health conditions, especially related to the kidneys, liver, or heart. Caution is advised in women who are pregnant or breastfeeding. Additionally, it is essential to avoid alcohol while taking this medication, as it may enhance drowsiness. FAQs. 1. How long will it take for the medication to start working? It may take 2 to 4 weeks to notice pain relief. 2. Can it manage diabetic neuropathy? Yes, it is effective for diabetic nerve pain. 3. What if I miss a dose? Take it as soon as you remember, but do not double the dose. 4. Is it safe to stop taking it suddenly? No, consult your doctor before stopping to avoid withdrawal symptoms. Thank you for watching. We hope this video provided valuable information. Please feel free to comment below with any questions or suggestions.